Okay, so today we're going to do one called Functional Medicine Didn't Work for Me. And the genesis of this is I've been in functional medicine probably since the time that functional medicine became functional medicine, and they started calling it that. And there was and is and should be an organization to the practice of addressing a case with a functional medicine model. But I don't think that model has ever completely been able to get into the public forum intact. So functional medicine, basically, people say, okay, it's if I'm changing function in your system, I can call myself a functional medicine practitioner. But that really isn't correct. And I'm not trying to put down people who are doing other things, or whether it's acupuncture or massage or dietitians who are doing diet, who are doing nutritional things, and they have their niche. But I just noticed in the last 6 months or so, maybe more, I'm getting just an awful lot of people who've already been to 2 and 3 and 4 and functional medicine practitioners. And the only reason that they came to me is because I got a couple thousand hours of me gabbing online and sharing things with them, and then they connect up with some of the concepts that I talk about, realize that those concepts were not addressed in the functional medicine practitioners that they have already been to. So not all functional medicine is the same. And I have a whole series that we did about a year ago, I don't know, 2 years ago, a year or two ago, about maybe what to expect from a functional medicine practitioner as far as taking an appropriate history, as far as not really getting into the case until you evaluate all aspects of the case. Because in functional medicine, you have somebody come with fibromyalgia, peripheral neuropathy, chronic fatigue, Hashimoto's, autoimmune disease. You need to know what all the moving parts are and before you start. Because if you don't, you're not going to be successful. You as a patient are not going to get better. The practitioner is not going to be successful in and of themselves. What I'm seeing is there's bits and pieces out there, and in all fairness, functional medicine, there's something called Functional Medicine University out there. There's a Functional Medicine Institute, but it's not like everybody's taking those courses. Those are courses that you take over a period of months. Those are courses that maybe some people take over. I actually took the Functional Medicine University courses years ago, and it took me months to go through it, because you're working, you have to study on the weekends, you have to read, you have to take the tests. But there isn't a functional medicine institute where you have, let's say, an internship, and where the functional medicine practitioner can go and have somebody helping them out when the very first patient walks in the door for them has fibromyalgia, peripheral neuropathy, chronic fatigue, they have SIBO, oral tolerance problems, sensitivities to everything on planet Earth, and this patient walks in and that person hasn't treated anybody before. Well, that's going to be tough. That's going to be tough. There's no institution that teaches that. So you have to, as a functional medicine practitioner, if you don't want to get kicked in the teeth every day, all day long, you have to really go out and start to grasp and get an understanding of the whole picture. And the whole picture, the thing I'm seeing is the lack of the whole picture concept in the practitioners that have treated the folks that I'm seeing. And what I mean by that is, for example, I have a lady in here right now. Look, and this is my everyday case, okay? But she is a health consultant, and she's been to functional medicine practitioners. She was to a local supplement store that sold her 3 bags of supplements. And she's kind of aware of what's going on in the industry. She's a health consultant. But when we got here and we did our evaluation, there was a very, very clear two clear problems that was going on with her issues, and they were pretty basic to being a functional medicine practitioner, in my opinion. They were that she had an enormous amount of food sensitivities, and so her gut was kind of broken down. She was developing these food sensitivities, and she was, very thin, had low blood pressure, which everybody tells you is normal, and it's not, and low blood sugar. Now, none of that's very exotic. And yet, not one person that she had gone to for, and this has been over several years, not one person that she's gone to has addressed any of those things. If you were to go to a functional medicine seminar that didn't have one particular model that they wanted to promote, and maybe that model is come to our seminar and in one weekend we'll teach you how to be a functional medicine practitioner by having you do this blood test. You have to know how to read it, and you do the blood test, and we have a computer program, and you just put all those markers from the blood test in there. It'll spit it out. You'll give them these supplements from that, and you'll use this diet. And for one group that's teaching that, it might be the autoimmune paleo diet. For the other group, it might be the Walls protocol. For the other group, it might be just fix the leaky gut. And all these things have legitimacy, but none of them, there's like no such thing as like, do this blood lab, do this diet, and a person's going to get better. 80% of the time, that's not going to work. Maybe more. So I guess where I'm going with this is it's become a little disturbing to me. I'm getting people who have been 4 or 5 functional medicine practitioners already. So after I get the history, usually my next question is, so tell me like what each doctor told you was wrong. And clearly several of these doctors were in over their heads. They were taking cases that they really shouldn't have been taking. And but again, this isn't like in the medical profession. I don't know if that's a good today. I don't even know if that's a good analogy, where you go into the doctor, and at least in theory, your endocrinologist knows about endocrinology, and at least in theory, your gynecologist knows about gynecology, and there's a relative consistency there. And I guess I've had a couple of people who were kind of dragged in here lately. Because there'd already been a bunch of functional medicine practitioners, and it didn't help them. What is this guy going to do for me? And frankly, I think, well, what am I going to do for you? And then I sit and I listen. I go, wow, there's plenty of things we can do for you, because this hasn't been done, that hasn't been done, this hasn't been done, this hasn't been done. So, not all functional medicine practitioners are the same. I guess what I'm trying to relate is, I think you may need to be a little bit more thorough in your investigations as to what the background of the person is, what their time in practice has been, what has their experience been with the types of things that you get. I know I just get, like, my cases are just like I've tried everything and now there's you, and you're my last hope, and those things. That's a lot of stress. But I also am very careful as I can be in evaluating those cases when people call me, to make sure that their case fits the model of lifestyle changes, dietary changes, and nutraceutical support, but also has some experience in handling cases, management of cases. Just what a lot of people are getting into this, and because they can. Frankly, a lot of people are getting into this because they feel like it's lucrative. I mean, that's just the reality of it. I'm at the seminars, I listen to people talking about that, and I'm thinking maybe you should learn how to fix people first before you start charging the types of fees that you're talking about. So I just thought, I just feel like functional medicine properly applied to the proper candidates, it can literally have seemingly miraculous results, partly because we do bypass a lot of the not sexy stuff. Oh, I got low blood sugar. Doctor said that's great. It's not high blood sugar. Oh, I got low blood pressure. Doctor said that's great. Yeah, it's great. You're not getting blood to your head, your extremities, your gut, or anywhere else. Or for those of you who are guys, you're not getting blood to that one extremity that matters to you so much that you're taking the little $98 pill for. And that's functional medicine. Functional medicine is it's not sexy. It's blue collar work. It's not about doing $5,000 worth of labs out of pocket and then treating every single thing that there is in a lab. So if you go to a functional medicine practitioner and they're not doing a really, really thorough history, our history is 289 questions. Now, maybe it doesn't have to be that thorough, but it should be something very, very thorough. And if it feels like it's a cookbooky type of thing, functional medicine is anything but cookbooky. I can have 100 people come in here with fibromyalgia and no two are the same. I can have 100 people come in here with a gut problem and no two are exactly the same. If they don't have an understanding as to why their SIBO or their leaky gut protocol isn't working and they don't have a reason for it, that's kind of a red flag, because you should not look. There's only so many things that can go wrong with a gut, okay? And so in the proper functional medicine world, you should know what they are. Now, some of them can't be fixed, but you should know that too. You should know that too, and you should know what's within the framework of your world and what's not. It's a very personal thing. I think functional medicine is a very, very personal thing. It's not cookbooky. It's not, here, do this diet. Oh, it's not, okay, I took all the supplements and they didn't work, and or they make me worse, so what happens? And it's not like, okay, well, let me talk to my vitamin rep and see why you have this, why you're having this reaction. You know, I'm just hearing so much of this, and I guess what I'm saying is I just think a lot of people are now getting turned off to it. I'm hearing things about what I said before. Well, I went there and I paid I've heard some really huge sums of money being paid to people who didn't feel to me like they really were that skilled in this area. So I'm starting to feel like maybe, even though functional medicine is exploding, I have a feeling it's starting to hit that point where people are starting to question it a little bit more. And so all functional medicine practitioners do not have the same education, but you need to I would investigate first. The best thing is usually if you've been referred there. If you've been referred to that place and you know people who've had a similar problem to you, and that has been helped. I mean, I'm a chiropractor too. Okay, I mean, I've practiced chiropractic for a long time, but honestly, that's really the best way to find a chiropractor. I mean, chiropractic, you can go to 100 different chiropractors and get 100 different techniques, all of them which work, if that person is really good at that technique. And I guess what I'm trying to say is, in functional medicine has become the same. You can go to 100 different functional medicine doctors. Who's going to do leaky gut? But because everybody does leaky gut. But just for Hashimoto's, there's 39 different triggers. I have yet to have a person come in here and ever go, yeah, well, this person said there was a bunch of triggers and we were working down the triggers. Well, I mean, that's basic to treating an autoimmune thyroid disease. I mean, if you're not going to know what the triggers are, and when you start out, your chances of being successful in that case is like zero. You may get short-term responses, but they're going to be short-term, and then you're going to crash, and then it's going to be like the lady I was talking to the other day. Well, I went here and I did this and it crashed, and then I went there and I did this and it crashed. And now I came to you and I did this and it crashed. So what did I say? Oh yeah, that's functional medicine. I said no. I said you were doing this. You were doing extremely well, and now you crashed. You didn't just have like a blockage to our next step. You crashed. meaning you did something different because you were doing well. No, I was following you. I'm following you exactly, everything you said. No, when we got done talking, she was doing 2 things I specifically told her not to do the first day. And she thought that eating a good diet and keeping her sugar under control was eating like 2 pounds of fruit a day instead of eating like 2 pounds of Hershey bars a day. We got that under control. Now she's doing well again. I'm just using that example of she went to the 2 previous doctors, crashed, that was the end of it. They didn't know what to do. They should know what to do if they went through Functional Medicine University, which is a course that you take over months, and you take you actually have to study, and you actually have to take tests, and you have that whole layout that you understand before you get into this. And I don't have any affiliations with Functional Medicine University other than I took their course, years ago. So I guess what I'm trying to say is, like, you have to start becoming your own consumer advocate. And because I want to see people going to functional medicine practitioners who are serious about what they do, who have taken the time to become conversant in the discipline and get the results that we do. And don't get me wrong, we have patients who don't do well, but they're a small percentage. They're a small percentage, and they usually get that they were a tough case, and we discussed that ahead of time. But if you really, really know what you're doing, you should get some pretty consistently successful results with the patient population that is correct for a functional medicine model. So I guess I just needed to get that off my chest. But it bothers me. It bothers me if people come in, they've been 5 functional medicine practitioners and are still like, and they're still digging. They're still like, okay. So they're still like, I got to try something else, but I've already tried this functional medicine thing and it hasn't worked. And I guess that's just been it's really been starting to bother me a lot. So that's my getting it off my chest. But it's also just letting you know that it's a buyer beware type of a thing. It's a you have to dig in, just like you're buying a used car, or if you're going to a dentist, or if you're going to a chiropractor, whatever. Ask questions, find people who've been there, and try to get a feel for how, the type of experience that the person has before you go there, because in the vast majority of my profession, insurance doesn't cover full panels, so they don't cover what they're doing. If you're not a medical doctor or nurse practitioner or something, they don't cover any types of consultations or anything like that. So it really ups the game as far as you having to do your investigations before you walk in there and start investing your hard-earned dollars in the hopes of getting some sort of a response. So, okay, so that's my presentation of the day.